I mean, it doesn't help that they didn't give it a very clear name. ASCUS, or atypical squamous cells of unknown significance, doesn't really give you any insight on what this actually means when you get this for your pap smear results. When we do a pap smear, what we're doing is using a little brush to collect cells from the surface of your cervix, and then we send those to the pathologist to look under the microscope. And when they look under the microscope, they're going to see the cells doing different things. Sometimes they look normal, and sometimes they start to see features that are abnormal. When it comes to an ASCUS pap, there aren't enough features of abnormal cells to say that there's a big concern, but they are seeing some changes that we want to keep a closer eye on. A lot of time ASCUS is a result of HPV infection, so the next step is that we test you for HPV. And what we do after that really depends on your age and your own personal history of pap smears in the past. If you're under the age of 25, a lot of times your body's able to fight off that HPV infection. So instead of doing more invasive tests like a colposcopy, when you're under 25, the next step often is to just repeat your pap smear in 12 months. Now this is going to be different when you're over 25, because if you have an ASCUS pap and you get HPV testing with that and it's positive, then we're going to recommend doing a colposcopy. Remember, these are just the general guidelines. This is going to be different for you based on your age and your own personal history. What's most important in all of this is close follow-up with your gynecologist. If you have questions about your own history, talk to your OBGYN and discuss the plan is for you. And if you have a follow-up in a year or a colposcopy scheduled, please go to that appointment.